Perfect.
Ooh,
There we go.
See it.
Terrific. So tell us a little bit about what is going on over there in Wilmette.
All right. Hello, everybody. My name is Demi. I'm a manager over at Osteostrong in Wilmette. And this week is not this week, this month is Osteoporosis Awareness Month. And if you haven't heard about Osteostrong, our main goal is to help improve your bone density through heavy impacts loading force. And it's set up in a way that you can do it safely without hurting your joints, your body, and a session coach is with you along the way the entire time. So it's very easy for you to do and improve your bone density and possibly reverse your osteoporosis back to osteopenia and just improve your overall well-being. So in the meantime, I have been talking a little bit about the significance of a vibe plate, which is something that we have in the center and we do before and after your session. So what that does is we do some balance exercises on there and it helps improve your balance, but it helps more on a cellular level as well. So with the importance of using the vibe plate, at least for us in the center, is it helps activate your muscular tissue and increases your circulation and helps enhance your benefits of when you do spectrum, which is what Osteostrong has. So when you're stepping on the vibe plate, aside from balance, though, it's also very good to boost both your bone mineral contents and bone density by accelerating the bone formation and metabolism. So it helps to protect you against bone loss in older individuals and helps increase bone and muscle mass in younger individuals. It also helps promote bone and muscle strength as a primary treatment, as well as physical and other responses as well throughout the body. Because it also, aside from bones, it helps to increase your skin blood flow. It helps your blood circulation, muscle strength. It helps reduce the aging related loss of muscles and bones. And it helps stimulate the lymph glands, contributing to a healthier immune system, which is something we're all striving for right now. And we should every day, is keeping our immune system strong. And it helps to decrease chronic back pain with potential and preventative therapy. So these are just some tips right now on what the vibe plate is good for, how it helps promote bone health as well as your immune system and a cellular skeletal level as well. So with that, I will pass it on to you, Dr. Jordan, with your tips for this osteoporosis month.
You forgot to mention that I rocked the vibe plate on, was that, Wednesday?
Yes. What were you doing? Tree pose?
Yeah, it was awesome.
Yeah. That's a good one to do. Holding one foot while you're vibrating, guys. Serious balance.
Yeah, we did some squats. What else? It was very cool. So I would definitely recommend it if you have not been over there to give it a try. It's super cool. The entire thing is super fast, which is nice because, again, you know, what is finite in all of our lives but our time. So I was very impressed, and Demi knows if she was closer, I would be over there all the time. But especially based on our current circumstances where I have no one to watch Mr. Parker. my time is limited even more than normal. So based on Osteoporosis Month, I thought that we would talk a little bit about bone health and supplementation. This was a really popular topic when we spoke a few weeks ago. So I've added some information. We're going to touch on a couple others. And as always, if you guys have questions, please feel free to post them. If anything comes up later, I'm going to put Demi's contact information in the Facebook so that you guys can reach her there as well to answer any questions about Osteostrong or the services that they have. But let's jump right in. And some of the information provided today is actually from one of my mentors in Kentucky, a medical physician who has a functional medicine spin. Great genius of a man. When it comes to bone health, a few things that you should be aware of that many of us don't think of is that our internal health, so our bones, our joints, our muscles, our organs, even our digestive system will mirror what's going on in one of those other systems. So our skin mirrors what's going on inside, which I think a lot of us have a tendency to forget. But wrinkles, it's been shown that the more wrinkles that you have, the weaker that your bones are as a general rule, because that has to do with the connective tissue. And if the connective tissue of the skin is not strong enough, the tensile strength there is not strong enough, it will also not be strong enough in the bones. So not only for aesthetic purposes do we want to watch wrinkles, but also as a mirror or a indicator of what's happening on the inside. We want to pay attention to what's going on there too. Having your blood tested routinely. I know a lot of individuals will, of course, have a DEXA scan to show what their bone health is. But of course, you want to be taking a look at what your vitamin D levels are. And from a functional medicine perspective, I like my patients to be above 60. And that is higher than your allopathic physician may be looking at. So please, you might want to take matters into your own hands and ask if you get your results back and they say that vitamin D is fine, but it's below that 60 threshold, you might want to inquire as to raising that a little bit. A few other tests that I recommend, and I had to make some notes here to make sure I hit everything nice and concise. Looking at your homocysteine levels, because that's an indicator of inflammation in the body. And we know that higher inflammation is going to leach calcium from the bones. It's going to make our bones a little bit thinner. So we want to keep our inflammation down. Food sensitivity testing is really important. We did a video previously on food sensitivity testing, looking at your IgG antibodies. Again, it's related to inflammation. There's a lot of genetic testing that can be done these days. So an MTHFR test, a full micronutrient panel. In our office, we look at what's called intracellular vitamin levels. So we want to see if those vitamins that you're taking are actually getting into the cell as opposed to just sitting out and floating in the plasma. All the action happens on the inside of the cell. We want to make sure that your vitamins are getting in there. Of course, your physician's going to be running a CBC, a CMP. Those are very important tests as far as bone health. C-reactive protein, that's another one to look at inflammation levels. Interleukin 6, again, there's a whole host of things that your doctor can be looking at. Please make sure that each of your physicians has your full spectrum and your full history available to them. All of that's very important. And nutrition. Demi and I did a video on meal planning. We'll probably come back to touch on that subject again. Nutrition is so important for inflammation. If you're currently drinking diet soda, I ask that you get rid of that ASAP. That has been shown to increase inflammation and decrease bone health pretty regularly. I'm a big fan of eating an organic whole foods diet. If that sounds familiar, please. I'm sure I've repeated it many times. It is a foundation of health and wellness. Figs are awesome. Broccoli, salmon, almonds, all of that. Some of my favorites, great for bone health and strength. Of course, avoid salt and grains. Gluten is very inflammatory. It will affect the thyroid. It will affect our gut health. So we want to minimize that if we can. Drinking decaffeinated tea is fantastic. Some of us will do 1 cup of coffee a day and then switch over to tea. Increase your water as well. With this stay-at-home order, a lot of us have changed our schedules. You are limited in, obviously, your ability to go out. Some of your routines may have changed, so that may impact your wellness habits. So please make sure that you increase your water every single day. Some acid suppressing medication has been shown to decrease bone health. So if you are on a Prilosec, a Prevacid, a Nexium, any sort of SSRIs, which are used for depression and anxiety, that will actually impact bone health as well. And also anti-diabetic medications. So please take a look, make sure you're talking with your physician about the side effects of medications that you're taking, and they can actually change over time. So even if you have successfully enjoyed the benefits of a pharmaceutical intervention for 3, 5, 10 years, If you are suddenly now experiencing modifications, please bring that up to your physician because, again, those side effects can change. Supplementing with digestive enzymes is super important. As we age, our digestive enzymes will decrease. If we're on medications, they will decrease as well. And that will impact how many vitamins and nutrients we're actually able to get from our food. So that's a really easy way to make sure that you're getting the best bang for your buck out of all those healthy foods that you're consuming, is to do some digestive enzymes. And of course, supplements that we talk about routinely are going to be our zinc, our calcium, magnesium, all of those combinations, vitamin C. I recommend elderberry as well. Elderberry is good for bone health also. Doing anything that's going to decrease inflammation is actually going to increase bone health as a side effect. So eat healthy, take your anti-inflammatories, supplement anti-inflammatories. Let me take that back a step. And also some direct bone correlation supplements would be things like strontium, what else? Different amino acids. And of course, please make sure that you're discussing with your physician before you're starting or stopping any supplement regimen. And only the physician that made a pharmaceutical recommendation should be the one to modify that pharmaceutical as well. Please don't take that into your own hands. You want to make sure that you are in very good speaking terms with your physician as far as what you're taking, what you would like to be taking, and why you feel that modifying some of your supplements might be a good idea. Being honest with everyone is very important. Osteoporosis is directly related with atherosclerosis, which is the hardening of the arteries. So you want to take a look at where your calcium is living. And that's the problem with inflammation, is that it will take calcium out of the bones and deposit it places where we don't want it, such as the arteries. I have seen in many patients that they just start taking calcium. I would ask that you have your physician run your calcium levels. What you want to make sure is that you're only supplementing with calcium if your blood levels are deficient, and also only supplementing again if that inflammation is out of control, or excuse me, if that inflammation is under control. Because if you start to supplement with calcium and inflammation is too high, that calcium is not going to go into the bones where we want it. That calcium is going to end up in the arteries where we don't want it. So we need to keep all of that under control. You want to take a look at ways to decrease that heart attack and stroke risk. That would be one way to make sure that our calcium is actively being deposited into the bones. We have seen that heart failure, stroke, hip fracture is 10 times likely with those scenarios. And it is hip fracture is 4 times more likely with coronary artery disease. So please make sure that if you have been diagnosed with any of those comorbidities, any of those conditions, that you're actively speaking with your physician about ways to strengthen the bones and decrease that inflammation. So that was some quick and dirty information on the supplements that we would recommend. If there's questions, again, Demi and I are available. I'm trying to watch Facebook and our and our Zoom to see what kind of questions we have, but please feel free. You can unmute yourself. You can put a question in chat if there's something that we can answer as far as supplements. I think that I ran down my list of everything I thought would be beneficial. I do recommend that you take vitamin D with K, because that will help put that calcium where we want it to strengthen the bones as opposed to in the vascular system. What's a couple other ones? I think we did pretty well on running down our list. If we don't have any questions, you and I were just so efficient in the vibe plate and vitamins and how everything works
to the point
together.
But I'm now with Facebook. If anybody has questions that even pop up later in the comments, we can address them.
Absolutely. Have you seen clients that come in and that do the vibration plate in addition to their weekly sessions? Can they do that? Is that an option?
You mean always doing the vibe plate with Spectrum?
doing it even when they're not going through the routine. So like if they're coming in twice a week to run through the routine, could they be coming in and doing the vibration plate additional days? Is that an option?
Well, our members only come in once a week for everything. That's what's shown to have the most progress in strengthening the bones with Osteostrong is once a week. I have heard some of our members do have their own vibe plate, or their gym or somewhere else that they have access to one and they use it outside of us. So they can definitely do that on their own, but Osteostrong as a whole is only once a week.
Got it. Yeah, at our office, we have a vibration plate and I should be on it every day. I'm not on it every day. But I absolutely endorse doing that routinely. I like that.
Yeah, it's good stuff. Takes a little getting used to, but it's good.
And it has some additional benefits, and that's why I think that I'm used to the more frequent recommendations. In addition, you guys are working from a musculoskeletal side, and the more regular usage, at least seen in our clinic, is improvements in lymph flow. We have clients that do physical therapy. They'll do a physical therapy session while they're on the vibe plate, so they'll be doing exercises on the vibe plate. So we take, and obviously
we're going to start incorporating that. I was doing some research on like what exercises we can do on it. So we're slowly going to start incorporating it and suggesting, if members are comfortable on it, to go ahead and do some of the exercises on there.
Awesome. Keep it fresh. That's fantastic.
Oh yeah.
Very cool. Well, if we don't have any questions, what do you have coming up, Demi? Tell everybody a little bit about what's going on, because you guys, we've been open the whole time, but what do things look like for you right now with some of the modifications in reopening currently?
So we obviously, everyone has to have a mask on when they're in the center, and we have hand sanitizer, washing your hands, but when you come in, when you leave would be great as well. We have gloves if people want to use it. We're wiping everything down before and after. And our space is big enough where our extra modalities are in separate rooms. So we're limiting either one member in the center, or we can do two, but they would be in their separate rooms. So we're just working on still exercising that social distancing and keeping everyone apart so no one is right behind each other and close.
Yeah, that's awesome. That's very similar to us. We space patients out, so there's like a 10-minute window between, which allows us to go through and clean everything. And ideally, patients aren't passing one another, in our clinic, and everything is wiped down, and gloves and masks and sanitizer, the whole 9 yards. So
right.
I think everybody at this point has a pretty good handle on keeping their clients happy and healthy during this.
Yes. I think between everything you're doing and our modalities, how we support the body, these are the things that people need right now for that extra immune support.
Yeah, absolutely. Well, very cool. So if questions come up, everyone can reach Demi and myself, and we can discuss what you can be doing in Osteostrong to increase bone health, what you can be doing at home when you are not seeing them, at what point, and maybe we didn't touch on this for some individuals that didn't see our previous videos or aren't familiar with your services. At what point should they be seeing you or reaching out to you? How does that work?
At what point in their life?
Yeah, like you and I talked a little bit about it when I was in there, but do you primarily see those that are trying to that are osteoporotic, that are osteopenic, that are maybe perimenopausal, postmenopausal? If I'm watching this right now and this sounds interesting, at what point should I pull the trigger?
So we do primarily see a lot of our members are over the age of 50. That seems to be, I think people see osteo and think osteoporosis automatically. So that tends to be bigger part of our demographic. But this is good, honestly, at all ages because Osteostrong, if you're strengthening your bones, you are also strengthening your muscles, and everything we have as well helps with muscle recovery and bone repair. So athletes use a lot of the things we have going on. If you are younger and you're into sports or you want to build muscle, all of this helps as well. So while our main demographic may be older people, it totally works for younger people or even just being preventative and wanting to just preserve your body, help your body, and prevent osteoporosis. This is also a good way to start too.
Awesome. Yeah, absolutely. Yeah, it was super cool. And some of the other modalities, you guys are going to have to stay tuned and watch our upcoming videos, because some of the other things they do there is super, it blew my mind. It was very cool. So I will leave you with that teaser. You'll have to stay tuned to see what we have happening. But we had a couple people tune in a little bit later. So if you missed this, please watch the replay. If there's questions, pass them along. And we do this every Monday, 12:30 Central Standard Time. Get on our invite by subscribing to the Osteostrong newsletter.
Mm-hmm.
And stay tuned to my Facebook. I always put the link on there as well. So thank you all for your time. As always, Demi, it was super fun. And check them out. What is your, you offer a complimentary consultation, don't you?
We do. So I
check it
can
out.
go in the Facebook group and put the link in there.
Perfect. Absolutely. So if this sounded exciting, if it sounded interesting, share it with your friends. We could all be happier and healthier together.
Yeah.
And maybe I will see you there, not during stay at home because everything's private, but maybe we'll cross paths once everything opens up fully. Have an awesome day, and we will see you soon.
Bye, everybody.